At ParentingU, we believe a fed baby is best. This episode is geared towards moms who choose a breastfeeding journey. But whatever journey you choose for your family, we hope to be there to support you and help you along the way. Hi, welcome back to ParentingU. I'm Stephanie, and here we are with another episode all about breastfeeding. And we're welcoming back Becca Miller, a speech-language pathologist and lactation consultant, to talk to us more about breastfeeding in the NICU, which is the neonatal intensive care unit, which is where babies who are the sickest of the babies after they're born may go. And so, Becca, thank you for coming back.
Thanks for having me. I think this is a really good topic of a lot of scared parents, and we can tackle some of those fears.
Yeah, for sure. Well, tell me about, so I've had a baby. The baby needs to be in the NICU, but I want to breastfeed. What does that look like?
It's scary for a mom. You just gave birth to a 23-week baby that you thought was going to cook for another 15 to 20 weeks, and now they're out in this world fending for themselves, and you are lost as a mom, and you want to try to do your one thing as a mom that you know to do is to feed your baby. So it's trying to work past the anxiety, work past the fear, work past those sleepless nights to be able to give moms little tips and tricks to pump and produce milk and give them to the baby while the baby's unable to feed for themselves. And then once the baby is safe orally to latch on mom, it's helping mom position, find comforting techniques to be able to make sure they are able to feed their baby like they want.
So as a breastfeeding mom in the NICU, what does that look like? What is a typical, I know there's no typical day, but what does a typical day look like?
So a typical day is in the NICU, you go to cares every 3 to 4 hours depending on the baby's medical status. So a baby who was born at 23 to 24 weeks may be touched every 4 hours versus a baby who was born at 30 to 32 weeks may be touched every 3 hours. And what I mean by touched is they'll come do their vitals, they'll do their blood pressure, they'll do their temperature, make sure that the baby is good to be able to feed. So for a 23-weeker, if their temperature is less than 97 degrees, they won't feed the baby. They'll try to warm them up before they give them milk or anything just because they can develop neck from that. So if baby's okay, then they'll be like, okay, mom, let's go ahead and pump if that's a 23-weeker, and we can feed that baby your breast milk through an NG tube, which is a nasal gastric tube. That is a tube that connects the nose to the stomach for them to be able to get the nutrients they need from mom's breast milk. Or if it's a 32 to 36-weeker, we'll say, okay, mom, would you like to try to breastfeed and breastfeed the baby by your breast? Or if the baby doesn't have a coordinated suck and swallow breathe or on oxygen support, then we'll say, okay, let's try to offer the baby a bottle for right now just to make sure it's safe, train them to suck and swallow and breathe, and then when they're safe, put them on mom's breast. But it's always good to keep in mind that if for some reason that your baby doesn't have a good suck coordination or a good respiratory support, we let moms put the babies to the breast for non-nutritive sucking to be able to get used to breastfeeding while they aren't quite able to breastfeed yet.
Oh, that's interesting. So it kind of creates that bonding experience, even if you're not truly feeding.
Correct.
You're still doing some good work.
Yeah, it's all about the nipple stimulation. It's all about the hormones. It's all about having the baby on the chest to kind of mimic the breastfeeding and getting that pull from the baby on your nipple to increase your milk supply, but two, also for practice for the baby when they can't just yet feed by mouth.
Yeah. How does a mom and a dad, how does a family cope with the stress of being in the NICU and trying to breastfeed?
I think one thing coping with the stress is finding one person in the NICU, whether it be a lactation consultant, whether it be a speech pathologist, occupational therapist, child life, finding that one person to talk to. There's a lot of scary things that happen in the NICU. There's a lot of scary procedures. There's a lot of things that you'll notice are like your monitors will go off and you as a parent don't know what that means. Find one person to confide in because that's what's going to help you get past the ups and downs of the NICU and know that your medical team is looking 110% out for the well-being of your baby. You may not understand everything that we're doing, but we're doing it out of a place of love and that we're trying to get your baby out of the NICU as soon as possible.
Yeah.
And just knowing that information as a parent should give you some type of release, like we are really watching your back and we really care for you and your baby at the same time.
Yeah. What supports are present in the NICU for breastfeeding moms?
In our hospitals, we do offer pumps for moms. We offer the Medela pumps that have several flanges that come with them to make sure you have the most comfortable fit when you're trying to breastfeed. We also offer manual pumps where moms can pump outside by the garden or just to get out the room a little bit. We also offer meal vouchers for moms that get 3 meals a day to make sure that you're staying hydrated and healthy while you're pumping, to take one less stress off of you. We also have lactation consultants day and night throughout all of our hospitals in the system for 2 o'clock pumps when you're struggling, to be able to help you through those weary pumps and make sure that you're really getting the support that you need.
That's great. So mom's not alone.
Mom is definitely not alone. You as a mom just have to know to ask and feel comfortable asking, because there are so many ways that we can help you to make sure pumping and breastfeeding go the way you want to go.
Well, is there anything else you'd like to share with moms who may be facing a NICU stay, or you just for knowledge? Like you never plan for a NICU stay, but is there any more words of encouragement or anything else you'd like to share?
Take one day at a time. One feed at a time. Some feeds, some breastfeedings, some pumping sessions are going to go bad, but some of them are going to go really well. And it's knowing that you're doing the best that you can as a mom, and you wanting to pump and breastfeed is going to get you a long way, as long as you are willing to work at it and have the support system along the way.
Thank you for sharing that. That's really wonderful. And thank you for being here again. And thank you for being here with us on ParentingU, where we're with you on this amazing journey we call parenting. We'll see you next time.